Welcome you all. I am Mr. Rashid Iqbal, student of Generic BSN, 6th batch, first year, first semester, session 2024 to 2028 at SINAHS Institute of Nursing and Allied Health Sciences, Quetta. I, with my group members, has made model, and the model is about human urinary system and kidney. So, first Mr. Waqas will explain the anatomy of human urinary system.
Assalamu alaikum. Human urinary system is basically composed of four components: the kidneys, a ureter, urinary bladder, and urethra. Kidneys are known as major excretory organ of the vertebrates. Kidney receive 20% of the cardiac output, which is around about 1000 milliliter of the blood per minute. Kidneys have bean shaped and located in retroperitoneal, behind the peritoneal. It starts from thoracic 12 and end up at lumbar third. Kidneys are dark brown or reddish color due to excellent blood of supply. We have two kidneys, right kidney and left kidney. Right kidney is slightly lower due to the presence of liver. Then we have two main parts in kidneys. The outer region is known as cortex, the inner region is known as medulla. Medulla we have two parts. The inner medulla, the outer medulla. In medulla there are renal pyramids. In outer medulla, we have renal pyramids. In each kidney, there are 7 to 9 renal pyramids. They are open into minor calyx. And there are 4 to 5 minor calyx. They combine and they form a major calyx. Then major calyx open into renal pelvis. Then there is a central depressed area in the kidneys known as hilus. From hilus, a long tube is originated and going towards the urinary bladder. This tube is made up of smooth muscles and known as ureter. Then we have urinary bladder. Urinary bladder is basically composed of smooth muscles. We have special type of name known as detrusor muscles. Then we have urethra. Urethra is a long tube in males and short tube in female. As we discussed that kidneys are the filtering unit of the body. They filter 180 liter of the blood in 24 hours. Their structural and functional unit is nephron. Their structural and functional unit is nephron. We have two types of nephron, cortical nephron and juxtamedullary nephron. Cortical nephron are those nephrons which are present in the cortex region, and medulla and medullary nephron are those nephrons which are present in inner medulla. They name a different base in the basis of loop of Henle. Juxtamedullary nephron has long loop of Henle and cortical nephron has short loop of Henle. So this was the anatomy of the human urinary system. Now Mr. Rashid Iqbal will explain the physiology.
So, as we know, the kidney is very essential organ in the body which performs many physiological functions. Kidney contains more than 1 million nephron, and the nephron is the functional unit of kidney. If we discuss the functions, the kidney performs filtration, reabsorption, urine formation, acid-base balance, and endocrine function. If we discuss the filtration, the blood enters through renal artery into the kidney and goes towards Bowman's capsule. Bowman's capsule is the part where the filtration occurs. Kidney filters the toxic substances and waste products which are present in our blood. Then after filtration, it goes towards the proximal convoluted tubule and distal convoluted tubule. It is the part where the reabsorption occurs. Kidney reabsorb essential substances, amino acids, glucose, iron, and electrolytes which are essential for the body. After reabsorption, same filter product goes towards the collecting duct. In the collecting duct, the urine is formed, and urine contains waste products, those substances which are not essential for the body. The collecting duct is the part of nephron. After filtration, reabsorption, and urine formation, the same urine goes towards ureter through pelvis region, through renal pelvis to ureter, ureter to bladder. Bladder is the area where the urine is stored till that time, till excretion. So these are some essential functions. If we discuss the acid-base balance, kidney perform very important function in acid-base balance. Do you know when the acidic condition occurs in the body, the pH level of blood decreases. It means acidic condition is start. So in this condition, the kidney release hydrogen ions in the urine and reabsorb bicarbonate ion. Why? Because to maintain the pH level. In a basic condition, in alkaline condition, when the pH increases, in this condition, the kidney stops the releasement of hydrogen ions in the urine and reduces the bicarbonate ions to maintain the blood pH, to maintain the environment of blood. after the acid-base balance, there is one of the important function and the last function of the kidney, that is endocrine functions. There are some conditions in the hospital setting, there are some condition in the patients in hypoxia condition due to some factors. In this condition, the low supply of oxygen to cells and tissues. This condition is known as hypoxia condition. In this condition, there are some special cells which are present on the kidney, and those cells are known as peritubular fibroblast cells. These cells detect the hypoxia condition in the body. In this condition, the kidney releases erythropoietin hormone. The hormone goes towards the bone's marrow. The bone marrow, it is stimulated by the hormone. The hormone is known as erythropoietin and releases the red blood cells, increases the production of red blood cells. Why? Because to reduce the hypoxia condition which is generated in the body. So these were the functions of kidney that Mr. Waqas has explained the anatomy, and I have explained the physiology of human urinary system.
Thank you.